how does breast cancer typically present itself in younger women? Jennifer, from your perspective as a young breast cancer survivor and your knowledge with your national organization, what's your impression about how breast cancer typically presents in younger women?
I think one of the biggest challenges for young women is that there's really not an effective screening tool.
Right.
We all know about the importance of mammograms for older women.
Yep.
But dense breasts are a real challenge with mammograms, and most young women have dense breasts.
And most young women are not even, they're barely thinking about it at even age 40.
Absolutely, and they wouldn't be able to get a mammogram even if they tried.
Right. And so what would you say, 80% or so of younger women
About,
present with a palpable lump in the
right.
breast?
So we, we like to say that know your body,
Yep.
know when something is different,
Yep.
and that young women can and do get breast cancer. So if there is a lump that doesn't go away, in your normal cycle, call your doctor, be proactive, and make sure you tell them I want it checked out.
Well, and it's important that they push the doctor, because what's the typical reaction of the doctor?
No, young women don't get breast cancer.
Right. Or it's a fibroadenoma, or it's this, or
it's
that.
normal for young women to have lumps in their breasts.
Right, you have lumpy breasts.
That's right.
So not only are mammograms still important, even though somebody's young, but generally we start off with an ultrasound as one of the
That's
very
correct.
first tests.
That is correct.
Yep.
Absolutely.
And then tell us a little bit more about other thoughts you have about presentation and the important things when you're newly diagnosed as a young woman.
I think that, again, knowing your body, if you locate a lump and it stays there, to speak up, make sure that people hear you, you insist on all of the scans, and then I think depending on where things go, obviously then...
Talk about the treatment options.
Right, but then you talk about, there are a lot of things to talk
about. And in your own case, did you present as a palpable lump in your breast?
I did. I was on the phone with my mother, who's also a survivor.
Right.
And I wouldn't have been looking.
Right.
So.
Yep, so the take-home message is for younger women, know your body, know what's normal for you, and whenever you find something that's abnormal, pursue it aggressively.